today. I'm just going to give, please note that this is not going to be a long history of dermal fillers in the United States. But what I want to kind of talk about is I'm going to show you some slides that Kimberly Butterwood showed at the meeting. But I'm going to give more of a marketing and patient spin on it because I think it's important to really think about how the market has changed since collagen back way before Restylane came onto the scene. Then we're going to get into a few slides on practice marketing pearls, just some things that I've always thought about when I'm talking about expanding practices and how to drive more business into your practice. And then we'll give a brief overview on Belotero, just a couple of reminder reasons why Belotero is a great practice expansion opportunity. This is not about replacing anything that you're using in your practice. It's about expanding your practice. And that's the beautiful thing about Belotero. I've had the pleasure of launching Jupiter back in the day at Allergan in a past life. And so what's nice about staying in the HA market is that I really do feel that Belotero is a differentiated product from the other HAs that are currently on the market, and we'll talk about the whys behind that. Then we'll get into some clinical applications and patient types that you should really be looking for as patients that are ideal Belotero patients, and we'll talk about what kind of marketing support that your Merz Aesthetics reps can provide you. So let's start with the history of dermal fillers. So you see these photos here. This is the old collagen results. So collagen back in the day, there wasn't a lot of direct-to-consumer advertising around collagen. Patients would go into their dermatologist or their plastic surgeon's office, mainly dermatology back in the day, and they would get really fine line injections with collagen. Collagen was not a lifting product in any way. It was truly a line chaser, which is actually a good thing because that's what Belotero turns around to be. But that really was the only thing on the market before 2003. Then enters Restylane and a whole slew of products, as you well know, afterwards. And Restylane really changed the market. There was a lot of advertising around it. There was a lot of talk around the ability to drive results deeper as well as longer, because collagen really only lasted 2 to 3 months. But what we found was a real shift in the marketing conversation for all of these products. All of these products were indicated, have been indicated, except for Sculptra, in the nasolabial fold region. So it's probably the reason why when patients still come into you today, they talk about their parentheses, they talk about their nasolabial folds, and they don't know much about what's causing that volume loss. And it's not necessarily the nasolabial fold that is the issue, but the reason for that and why they're talking to you about that is because that's the marketing that they've received. So that's something to keep in mind. And then obviously transitioning into 2013 with the entrance of Voluma, now we're seeing this shift in the marketing campaigns towards mid-face volumization. Everything is about the mid-face, and you've got to fill the mid-face. And the mid-face is important, and obviously the mid-face is really important for effacing the nasolabial folds if there is volume loss, but it's not just about mid-face volumization. And the one thing that I always want to caution people about is because we know the price of Voluma is significantly more than some of these other products on the market, it's very easy to really blow a patient's budget very quickly by offering just mid-face volumization with Voluma. Oftentimes there's multiple needs that a patient has. You really have to balance the patient's wallet to what their most important needs are when you're making those decisions with the patient. So just wanted to kind of give a different sort of marketing and sales from your perspective spin on why the patients are coming in asking for what they're asking for. So let's move into some practice marketing pearls. One of the biggest things, and I've been through so many practices throughout the United States, and when you ask, is your practice patient friendly, the two biggest things that come to mind is really the practice aesthetic. So I searched the internet looking for pictures of ugly practices, and guess what? There aren't a lot, but this is the only one that I could find, and it's because nobody's going to market their practice if it isn't aesthetically pleasing. I will tell you that this is an aesthetic practice that I know very well in the Southeast, and this is the difference between what practices should look like. When you think about trying to transition a practice, if you are you know, in your past have had more of a clinical practice and you're transitioning into a more aesthetic practice, you really do need to take a step out into your waiting room as the first place that a potential aesthetic patient enters and really take a good look at it from a completely different perspective. And you really need to take a look at your practice as, is this a high-end spa environment, or is this a medical practice? And really, you know, really dig deep on that one because it's absolutely important. And I say high-end spa because if you think about the investment that you're going to ask these patients to make in you and into these products, think about the difference in that investment if they walk into Miraval, which I was there luckily a few weeks ago, and see this beautiful spa environment. If they walk into a practice and it looks like the practice on the left, the question is that going to give that feeling of, wow, I'm in a very special place? So definitely something that you should consider when you're really trying to expand your practice. Another piece of it is it merchandised appropriately. And what I mean by merchandised is, do you have a before and after book? Have you created your own before and after? Highlight. That would be, I'd say, the opportunity for you photos. I would highly recommend that you.
Jen, you're cutting out, Jen.
Take the time.
Jennifer.
Find to show your. Oh, okay.
Jen,
I'm not sure how to fix that. Is it any better?
Off.
Yes.
Better.
Oops. Oh, hold on. Is that better?
Yep.
Can you hear me?
Yep. We missed a little bit about the before and after book, Jen.
Oh, okay. Oh, okay. I'm so sorry. It doesn't tell me when I'm cutting out, so if you'll just let me know, I apologize for that. So what I was saying about the before and after book is that it truly is critical that you create one A. It's great to have the company before and afters. I think those are really good and helpful tools, but they really should be your photos. They should be what you do best, and they need to be taken correctly. So there are lots of tools out there to help you identify how to best take a photo and what lighting you need, the type of camera you need to make sure that you get the best outcome. So that's the number one thing when I say merchandising. The number two thing is if you have the opportunity to create a video loop, and nothing that's going to be annoying to your patients, but something that you can put on mute. You can wrap through all of the company's video loops that they offer for their products. You can create your own. You can actually put your before and after pictures in that manner versus the book. There's ways that you can create a loop. And then finally, appropriate levels of brochures and things like that. I've walked into some practices and it looks like every brochure for every aesthetic company is in the waiting room. You really want to focus on what's most important to you for driving your business and make sure that they're in a spot that is not going to make your waiting room look messy. That's one thing you see with the picture on the right, that is pristine. And this is a dermatologist practice, as I said, in the Southeast. So this is a truly aesthetic practice. So just some ideas there in terms of the practice aesthetic. And then the second piece of it, I'm going to go to staff. I think these two things, staff is probably number one, honestly. The practice aesthetic is the initial thing that people see when they walk in the door. But really, at the first entryway for an aesthetic patient is that person at the front desk, male or female, doesn't matter who it is. I would say that one of the mistakes that a lot of physicians and injectors make is, I call it skimping on their front desk staff. I think it's absolutely critical that you don't look at the average wages for a medical practice assistant at the front and receptionist at the front, and make your decision on how you're going to pay that person, because that person can make or break your aesthetic practice. So their phone skills have to be stellar. Their ability to interact and their emotional intelligence of patients has to be stellar. Their ability to think on the fly has to be stellar, and their ability to to really work with aesthetic patients, as you all know, are different than normal medical patients, and they're demanding, and they have to be able to manage those patients very well. So I would say that it's absolutely critical that you really invest in the right people and make sure they're extremely well trained on everything you do. And I would also say that if you, however you do it, some people make an incentive. Treat your staff is an absolutely critical piece of this. If you want to sell something in your practice, treat them with whatever that is that you want to sell. I would love for you to treat them with Belotero. We would be happy to supply you with product to help treat your staff if they're appropriate patients, because it's a huge opportunity to truly sell what you do best. So then let's go to, but you want new patients. How do you drive new filler patients? This is not going to be new. I think you guys have all heard this before, but maybe I'll put a different spin on it. The number one thing that you can do is make sure that your outcomes are absolutely off the charts. So it might mean that you might not be the best at everything, but be really, really good at the core things that drive business. So make sure that you're really good at neurotoxin. Make sure that you're really good at fillers. And maybe not fillers all over the face just yet. Really make sure that you get the training and the practice, because outcomes are absolutely critical. You want that patient to walk out, and you want that patient to be satisfied and happy and come back, and as well as tell their friends, if they have a conversation with friends regarding treatments, that those outcomes, that they should come to you because of your outcomes. The second piece of that is follow-up. I know that oftentimes we get busy, and I would say that follow-up is absolutely critical, not just on first-time patients. Oftentimes people say, well, I have a new neurotoxin, or I have a new filler patient. I'll call them a few days later, or have my staff call them a few days later to see how they're doing. If you have the time, call the patient yourself and say, hey, just wanted to check in on you and make sure you're doing well. Make sure you're happy with your outcome, because that's absolutely a critical piece. It just kind of really brings that patient into your fold, that you really care about them and you really want to make sure that they're satisfied with their results. The second thing is internal marketing. Everyone wants to talk about external marketing, and they want to spend a lot of time and energy and money on external marketing. And as I said, this is all stuff that's been out there for years. I'm not telling you anything new, but internal marketing is absolutely critical. So retention, retention, retention. You want to make sure, and part of it is that follow-up, that you are bringing those patients back, that you have a really good system that's very easy, like some sort of EMR or constant contact, that you're getting your patients' email addresses, and that you have the ability to market to them. Another piece of that is a cosmetic needs assessment, making sure that you've got a document that patients fill out in their paperwork, and as well as if they come back in 6 months, have them fill it out again. A needs assessment is not, are you interested in Botox? Are you interested in Xeomin? Are you interested in Belotero? It's really around, are you concerned about your etched-in lines around your mouth? Are you concerned about your nasal, your lines between your nose and your mouth? It's really about the issue that a patient might look in the mirror and see, not necessarily on a treatment. So that's one mistake that I see a lot, is that people will try to say, we'll create a document that's really treatment-based, not needs-based. And then the final thing is external marketing. So from an external marketing standpoint, that should be the last thing that you invest in, especially for those of you that have established practices, whether you're trying to transition clinical patients over to aesthetic patients, or if you're trying to drive your aesthetic patients to get different treatments. It's really about focusing on internal marketing. External marketing really should come for injectors that are just starting out, and for when you feel like you've saturated your patient base, which I would always challenge people that your patient base is probably never saturated. So really, external marketing should be the last thing you think about. Obviously, you want to make sure you have a great website. You want to make sure that your website is mobile. and very easy to navigate. And you absolutely want to make sure that you have your before and after pictures, if obviously if patients give you permission to on your website. So those are some of the things from the external marketing standpoint that I wanted to cover. Okay, so let's get into Belotero. So because I work for Merz, I have to go through some of this. So our indication for Belotero, we are approved for injection into the mid to deep dermis for the correction of moderate to severe facial wrinkles and folds, such as nasolabial folds. Now, what gives us the opportunity to talk more about more than just nasolabial folds are those words such as. So what you're going to see in the coming slides is a lot of talk about etched-in lines and wrinkles, and moderate to severe etched-in lines and wrinkles. The indication for Belotero covers all of those lines and wrinkles. As long as it's deemed a moderate to severe wrinkle on the face, it is considered on indication and on label. So just want to make sure that's clear. Obviously, Belotero shouldn't be used in patients that have a history of anaphylaxis. So we want to make sure that doesn't happen. You want to absolutely check in on allergies. Really, of course, when you're injecting it, you don't ever want to inject a patient with an active herpetic breakout, and you obviously don't want to inject it into blood vessels. The good thing about Belotero is that the plane of injection that we recommend is so high up in the dermis that the risk of intravascular injection is very low. In terms of adverse events, the main adverse events that were seen in our clinical trials were swelling, bruising, redness, and hardening that usually resolves within 1 week. There were no rare side effects that happened in our clinical trials that I feel I need to talk to you about. So let's talk a little bit. I'm going to review a few of the slides from Kim Butterworth's presentation, and I want to talk about the whys behind Belotero and why it's different, because a lot of people think Coke and Pepsi in a lot of these situations, especially in the toxin world with, you know, Xeomin versus the other products. It's Coke and Pepsi. And in the HA world as well, you could probably do a toss-up with Restylane and Juvederm, Ultra and Ultra Plus and Perlane, and you could all get the same results with those products. Belotero is different, and I'm going to talk about the whys behind that. So, and it all starts with how it's made. So all three of the major brands, so Belotero, the Juvederm line, and the Restylane line are all made the same way. So what happens is you start with the liquid HA, and then you cross-link it, and you create a gel. And that cross-linking is at different levels. The gels are harder in certain places, harder than others. But what happens usually with, what happens with Juvederm and Restylane after the gel is made is they finish the product. So Juvederm goes through a blender, so it's a variable particle size. And then Restylane and Restylane Silk and Perlane are all pushed through different sized mesh screens. So all of the Restylane line is actually the exact same base product. It's just sized to different particles. So there's no difference in the technology there. It's just how they've sized the particles. Then they fill the syringes and ship them to your door. With Belotero, we do the same thing. We go through those first 3 steps. But we also do something different. Instead of finishing the product after those 3 steps, we actually take that gel and we add in more of the liquid HA and more of the cross-linking agent. So the product that's been cross-linked once gets double cross-linked, and then you've got this new HA that's cross-linked for the first time. So within the gel, you've got part of the gel that's double cross-linked and part of the gel that is single cross-linked. And as a result, you get this really nice, highly cohesive gel that really just sticks together. And this is what this is. It's 3 Petri dishes. They injected 1 cc of all 3 brands into the Petri dishes, added 1 cc of water, and then shook it. And this is what happens when you do this under no magnification. So as you see with Restylane, and all of the Restylane line look like this, you see it's a particulate product because it's pushed through a mesh screen. So you'll see the particles. With Juvederm, it's a little more cohesive, but you still see some particles in here. But Belotero really wants to stick together, and it really wants to stay as a cohesive unit. So the so what of this, because that's what I often hear is so what. So this is the so what. This is a study that was published in December of 2013, and this is a histology study. And what they did is they injected all 3 brands at the exact same angle, the exact same quantity of product, and then took biopsies. And as you can see with Restylane, you actually kind of see how the particles sort of fall a little deeper in the dermis, and they actually aggregate quite a bit. With Juvederm, it's a little less so. It goes a little bit in between the collagen and elastin fibers, but you still see the white aggregates for Juvederm. With Belotero, and this is the reason why we focus on etched-in lines and wrinkles with Belotero, is that in the dermis, in that mid-dermal plane, you really see how Belotero really integrates in between the collagen and elastin fibers. So the red is the collagen and elastin, the white is the HA. So it really just gets in between, and you don't really see the aggregation that you see with the other brands. So thus, you can inject Belotero truly in the dermis. Everybody talks about superficial, mid, and deep dermis. You're either in the dermis or you're not, because the dermis it's less than 2 millimeters thick. So as soon as you bury the bevel of a 30-gauge needle, you're already in the mid-dermis. So it's really important to know that Belotero Balance truly is really an intradermal product and should never really be injected subdermally. So those are my kind of the points of why Belotero is different. So we've got this unique manufacturing process that creates this highly cohesive gel that really gives you the opportunity to truly efface etched-in lines and wrinkles, because you can get to the right plane of the skin in order to efface those wrinkles. So where does Belotero fit in your practice, and how do you sell it? Because obviously, injectors oftentimes don't want to think about sales, and it's not about sales. It's about education and making sure that patients are well educated on A, what their needs are, and B, what you can do to satisfy those needs. They're coming to you for a reason. You are the expert. And, when they say to you, tell me what I need, they truly mean that. So you want to make sure that you take advantage of that opportunity to honestly tell them what you see. And you can have the conversation about what you see on their face, hand them that mirror, and talk to them about what their needs are. And then if they don't have the budget for it all, then that's when you need a treatment plan to make sure that you really create a plan for that patient, to make sure that they feel like you have their best interest in mind. You're not trying to oversell them, but you've educated them on what the value is for a variety of treatments in their practice. So Belotero is just one piece of this. So where are we talking about Belotero? So when I talk about etched-in lines and wrinkles, these are the kind of wrinkles that I am talking about. So I am talking about these vertical lip lines that you see. I'm talking about the cheek rhytids. These over here, these cheek rhytids, excuse me, those are some of the hardest things to treat. And I've heard it over and over again from many, many doctors that these are really tough to treat unless you're doing lasers. And oftentimes it's still not 100% with lasers. You have to do really deep ablative things in order to really get those lines and those rhytids. There's really limited treatment options for etched-in lines at this point. In the past, it's been chemical peels, a series of pretty deep chemical peels, as well as fractionated CO2, which obviously causes quite a bit of downtime. So there really hasn't been a lot of options for etched-in lines. And a lot of patients care about etched-in lines. And so what I would recommend is that make sure when a patient walks in your door, A, get trained on Belotero and how to inject it right. When a patient walks in and says, I don't like this line, don't deflect from that line. Say, I can treat that line. And I've got a great product that can treat that etched-in line and those etched-in lines on your face. I think in the past, because there haven't been great options, people will talk about lasers, they would talk about chemical peels. If the patient wasn't willing to do that, they would move on and focus on volume. It's not just about volume. It truly is about chasing lines in certain situations. So we want to make sure that everyone remembers that. So in terms of where you should be thinking about Belotero, we really focus on smile lines, so really those etched-in smile lines, marionette and nasolabial folds if they're moderate and if they can be treated intradermally. As I said, Belotero should always be injected in the dermis. You should never be subdermal. So meaning that when you have the needle in the skin, if you're tugging down and that skin doesn't tug down with you, with the needle, then that means you're outside of the skin. You always need to be in the dermis with Belotero to get the best results out of it. Also the oral commissures, the corners of the mouth. If you are intradermal with Belotero Balance, you can pop up that corner of the mouth very, very quickly and easily without a lot of product. But where it really shines are those vertical lip lines and, as I said, those cheek brighteds on the sides of the cheeks. So let's get into a few patients. You guys saw these if you saw Kim Butterwick's talk. So Rolana is actually the patient that's in all of our marketing materials. I actually did all of the model sourcing for these before and after pictures. And when I was doing it, I was specifically looking for patients that didn't need a lot of volume, but really did have a need for etched-in line treatment. So Rolana is 47. She's got really nice volume. She's a beautiful lady, but she truly did have significant etched-in lines on her cheeks and around her mouth that we were able to treat with Belotero balance. And as you can see, before and 10 days after, really phenomenal result. And I want to just make sure that you know that this was with unadulterated Belotero. We could not use Belotero, and the Belotero is not on label to be mixed with lidocaine. So then Julie, I wanted to put her in here because here's a patient, she's 34 years old. So here she's got moderate etched-in lines. She really needs no volume, but she's obviously had nasolabial folds her entire life. And now as she's aging and her skin is changing, she's starting to get etched-in lines that are bothering her. So she really, that's all she needed. She's just such a beautiful girl. And you can see here, before and 10 days after, what Belotero was able to achieve with one treatment. And then if you look at before and 4 months after, she still looks really great 4 months after treatment with Belotero. And then the final patient is Lisa. Lisa was an interesting case. She's beautiful, but she had significant etched-in lines in her nasolabial fold area, as well as her vertical lip lines. And what we were able to do, I did get her first round of before and after pictures, and I didn't think they were good enough. And I will tell you that some patients with compromised skin quality really do need 2 treatments. And I highly recommend that if you think a patient has bad skin quality, that you bring them back in 2 weeks to make sure that they don't need a touch-up. Because you've got to remember, these patients have never had these lines treated before. So it's absolutely critical that you make sure that you get full correction in these patients, and you truly do get phenomenal results. So this is before, and then 10 days after her second of her touch-up, which was a very minimal touch-up, just to really completely efface those etched-in lines and wrinkles. And then finally, this is her before and 4 month after picture. As you can see, she really did get she's getting some great longevity out of that. So talking about setting appropriate expectations, this is such a critical piece because everyone wants to say, well, you know, Belotero, I've heard, I'm sure you all have heard, Belotero doesn't last very long. It doesn't do this, it doesn't do that. There are a lot of factors that affect longevity in any product. And you can't look at an FDA clinical trial from a product that gives it up to a year and compare that to what we're talking about, because those are very controlled situations with a lot more product than is typical. And that's the only way, if any of these products, that you can get longevity that's longer than what's typical. So the factors that affect longevity in all of these products is the amount of product used. So if you think about it, if you're doing vertical lip lines, you might be putting 0.05 of an aliquot in that vertical lip line. You can't compare that to a CC in the nasolabial fold. It's just not apples to oranges. So that's a very critical piece of this. Also, metabolism is going to play a factor. As you guys, I'm sure, have seen, there are patients out there that chew up HAs. They chew up any product because maybe they're marathon runners and their metabolisms are very fast. The area treated is absolutely a big factor. So around the mouth, absolutely chews up product much faster than those cheek brightens. And then finally, depth. It's where you inject Belotero is the most critical piece. So you really want to focus on serial puncture technique, which is the old collagen technique. And for those of you that weren't injecting 10 years ago, it's a technique that's not new, but it's a technique that truly allows you to place Belotero in the dermis. And so that's where your FCS, your field clinical specialist from Merz, can really help from a training standpoint to make sure that you're really good at the serial puncture technique in intradermal injections, if you're not experts already, of course. So finally, having that conversation with the patient. So we talked about how do you sell it, how do you bring it up, how do you drive your business further with Belotero. So as I said before, it's actually quite simple. This is a very simple algorithm. If their primary concern is etched-in lines, inject Belotero. If their primary concern are deeper nasolabial folds or contours and hollowing, Belotero is not the product. And I'm probably the first product manager that will stand in front of you and say that I don't want you to use Belotero in places that it doesn't fit, because the G prime is so low, the viscosity is so low, that it wouldn't be appropriate. You'd be better off using Radiesse in those nasolabial folds in that lower face, and obviously on label for us. I can't talk about anything off label, but really better off using Radiesse in those patients, because it'll really give you that lift, and it's a great volumizer. Belotero is really about giving the finish. It's really that finishing touch for patients. And then the final thing is, if they're concerned with both, treat them both. So that means that you use a deeper filler. I can't talk about layering on top of each other. It's not on label. But you can treat a patient in different parts of the face. So if they have volume concerns, you can obviously treat the volume. And then if they have etched-in line concerns, you can treat them with Belotero as well. Now, if budget comes up, this goes back to that whole idea of a treatment plan. And I'm sure all of you have created tools for this. I hope you have, because it truly is an opportunity to not just pick up, somebody says, I only have enough money for one syringe. If you're picking up that one syringe and letting that patient walk out the door, I feel like you're missing a huge opportunity. If you are truly the consultant of that patient, you should say, well, I can't accomplish everything that we need with one syringe. Let's talk about what I can accomplish, what's the best bang for your buck, and sometimes that might be Belotero. If you have a new patient that walks through your door and what thing that they have that bothers them most could be etched-in lines, or if it's the one thing you can treat with one syringe, I'd highly recommend you think about Belotero in that position, because you can really get those etched-in lines and efface them completely, and they will love you for it. If you're trying to chase a deeper issue with one syringe, you're going to have more challenges in making that patient happy. So would highly recommend that you really treat both when you have the opportunity. So what kind of marketing support can we offer? So obviously our field clinical specialists are really amazing tools that we have. They are in our medical affairs team. So they are trained specialists. They inject themselves. They're incredible. We have great injection videos that are available to you through your territory manager, through Merz Aesthetics. We have a full range of in-office promotional tools, which I'll show you in a minute. We've got a brand new patient website that really highlights the great before and after pictures and what Belotero can achieve. We really are doing a lot of things on non-personal communication, and we've got, as I said, lots of marketing tools for you. I created a brand new campaign that I wanted to make sure was different from everything else on the market. So we've got this whole concept of wrinkled paper, because we're talking about the surface. So everything that you can get from your territory managers is actually textured. So the brochure actually feels wrinkled at the top, and it smooths out as you go down, and then you open it up and you see the pretty face. The one thing that I've heard over and over again is that all of the brochures look the same. They've got a pretty face on them with a different color, but a patient can't tell the difference between what one does and what another does. This is a concept that it really says exactly what Belotero does in the marketing materials. So we have brochures, we have countercards, we have our updated website, we have an in-office poster that you can either frame or put on your walls, and then coming soon we are going to have an in-office video loop. And Rolana, our main model, is going to be the link in the video loop that you can add into your video system. So with that, I just want to turn it over for questions, and hopefully this was beneficial and you feel like it was valuable time spent today.
Jennifer, thank you so much. This is Jamie. I am currently trying to unmute everybody to ask questions. That's about it. I just don't see any questions.
Webinar real quick.
I'm trying to unmute people, but I don't see the hands that are raised. I appreciate everyone. Hey, thank you so much. If anybody has questions, tell me directly at MedResults Network. So much.